Hello and welcome to today's webinar under the Hindu Wellness Series presented by Kauvery Hospital on the eve of World Brain Day that is observed every year on July 22nd. Our panelists today will discuss one of the most complex organ, that is the brain, which controls every process that regulates our body, whether it is our thoughts, our memories, our emotions, touch, breathing, temperature, hunger, and many more skills. Stroke or brain attack is a major global public health problem, and worldwide, brain stroke is said to be the second leading cause of death and the third leading cause of disability. As per statistics available, about 185,000 stroke cases are reported every year in India. And one stroke occurs every 40 seconds and one stroke death every 4 minutes. Doctors say it is the golden hour of 4 to 6 hours that is crucial for treating brain stroke. In some cases, the warning signs of a stroke can be obvious, but what's going on inside the body is very complex. 80% of strokes are also preventable. So without wasting more time, I would like to introduce our two panelists today who will take us through this important topic of how to take care of the brain and prevent a brain attack. Dr. Shivarajan Thandishwaran is a senior consultant in neurology and neuroscience at Kauvery Hospital, Chennai. He specializes in stroke medicine, neuro-rehabilitation, neuro-intensive care, general internal medicine, spasticity management, and gerontology. He has several publications to his credit in international journals, including Brain American Journal of Neurology, Neuroradiology, and he has also made poster presentations at various European stroke conferences. A member of the International Headache Society, British Association of Stroke Physicians, European Stroke Organization, and British Geriatric Society, Dr. Thandishwaran, along with Dr. S. Srihari, who is a consultant in brain and spine surgery at Kauvery Hospital in Trichy, will kind of set the ball rolling with a joint PowerPoint presentation on brain health in general and how we can help people suffering from the spectrum of neurological disorders. Between the two of them, they will cover the topics of ischemic stroke and hemorrhagic stroke as well. So a very warm welcome to both of you, doctors, and it's over to you for the presentation before we start taking questions from our participants. Thank you. So I think Dr. Srihari, you will start.
Yeah, I'll start. Okay. Okay. So, hi, good morning. I'm Dr. Srihari. I'm a neurosurgeon specializing in brain and spine surgery. So, this year's World Brain Day is on July 22nd, as you all know, and we are conducting an awareness program on for that. So this year's theme is brain health and disability, leave no one behind. So the main objective or aim of this celebrating yearly Brain Day is to create awareness and educate people in knowing the symptoms of stroke and how to respond early so that the disability is reduced in a major way. Only way we can do is to educate the people and create more awareness. So that's the aim of this presentation. So me and Dr. Sivarajan will be taking you through this presentation. So any doubts, any questions can be asked at the end of the session. So some basic statistics. It's a major burden in low and middle income countries. Everywhere it is a burden, but especially in low and middle income countries, for the past decade, the incidence and prevalence of stroke and subsequent disability has been increasing for the past decade. So, and in developed countries, this has been coming down because of the very strict awareness programs and strict screening protocols followed in developed countries. So in India, there is also a problem of underreporting, and the the mortality and morbidity is also associated with various stigmas of societal prevalent in the society. So the mean age is in India especially is a highly productive age group, that is middle age group, which causes a significant financial burden over the family, because those people are going to be the breadwinners for the family, and it is going to be very difficult for them to manage the family. So the first for 4.5 hours of stroke are going to be very important. So the first 4.5 hours comes into picture only when we know when the first 4.5 hours start. So for that, we should know something about how to identify a stroke in any of our family members or whoever we are working with or whoever we come across. So that is the major problem. So once you identify that something is wrong with the brain, we should immediately rush up to the nearest stroke care unit for avoidance of permanent disability. So the number of strokes per year is very high actually, around 4 million, and the deaths are also very high. Death is per se is a small portion of the problem. Actually, the disability carries a significant weightage in family and financial burden of the family and the nation also. So the main thing to know about any cerebrovascular accident or stroke or brain attack, it is preventable. It is preventable, and even if we somehow get a stroke, newer treatment options are evolving day by day. And the main thing that we should always remember, anybody who watches this program should remember, is time is brain. Time saved is brain saved. Each second is very important, and each second the neurons are lost. Neurons are lost means the functions are lost one by one. So time saved is brain saved. So what is a brain attack? Brain attack are basically is any abrupt interruption of blood flow to brain is called a brain attack. So brain, as you know, blood, as you know, carries all vital nutrients to every part of the body. Like that, it carries blood to brain also. Brain has the highest volume of blood supply per cubic centimeter. So the amount of nourishment the brain needs is phenomenal in the body. In that case, if something happens to that amount of supply, obviously there is going to be some problem. This abrupt interruption can happen due to two reasons. One is a block in the vessel. Another one is a bleed in the vessel, a burst of the blood vessel. So stroke is basically a brain attack where the blood flow to the brain is affected. That is the basic definition of stroke. So two types of stroke. One is a block in the normal vasculature. That is, all these blood vessels are tube-like structures. Whenever there is a block in one tube, the flow is obstructed, or similarly, whenever the tube is broken, again the flow is disrupted. So this is a pictorial representation of the same thing. This is a small blood vessel. This is the magnified view of the same blood vessel. This sort of obstruction, this sort of clot is formed, and it starts forming very early in life. And once we take all the precautions, this forming of blocks or plaques is controlled to some extent. That is what we are trying to do in trying to prevent the stroke. So this is another type of stroke where the blood vessel, the tubular structure breaks and the blood dissipates into the brain parenchyma, thereby stopping the normal blood supply and also increasing the amount of substance the brain can hold, the skull can hold, thereby creating very dangerous side effects like immediate death also. So from here onwards, Dr. Sivarajan will be taking over and we will be guiding us on how to identify a stroke.
Thanks, Dr. Stegri, for giving a wonderful introduction on stroke and the importance of time to come into hospital and get treated as quickly as possible to prevent a major disability. And thanks to the Hindu for creating this awareness program on behalf of the World Brain Day. And also thanks to Kauvery Hospital for doing this wonderful initiative to create awareness in the public at large. So now I'm going to focus on how do we identify a stroke. And quite often when patients experience of stroke, often it turns out that they ignore it and they may attribute this to like sleeping in a very awkward posture. That's probably why their arm is numb. They may probably have had previous issues with their back, and that's probably why their leg is numb and so on. But quite often, when a stroke strikes, because the way how the brain is wired, we have quite a large representation for our face and hand. When by evolution from primates to humans, we have evolved to use our thumb and also evolved how to use language. So obviously, when somebody has a stroke, the obvious areas in the brain that are going to be involved are your face and hand. So to help identify a stroke in the earlier stages, it is easy to follow these FAST acronym, FAST, face, arm, speech, and then time to call for help. So if you look at the next slides, if you ask somebody to clench their teeth, you might notice that there is a bit of asymmetry on one side of the face. And often on the same side, they may not be able to keep their arms up when you ask them to hold in front of them. And if you ask them to say a few words, sometimes the words may not come out or it may be slurred. And if any one of these three are there or all of them are there, it is time to call for help. So the reason why we emphasize on time is because each and every second is very important, because data shows that every passing second, you lose millions of neurons in the brain. And if time is wasted, then a lot of brain tissue is wasted. Quite often, we see patients having a mini stroke. Like most cardiac patients may experience a angina sort of pain, and then subsequently they may come to a ER with a large heart attack. Same way, nearly 25% of stroke patients often, when we interview them, say that they've had a mini stroke-like event in the week prior to their stroke. So the mini stroke symptoms are usually temporary, that last about 10 to 20 seconds, on even up to, say, 1 minute, usually associated with maybe a speech arrest, a dizzy spell, blurring of vision, and so on. I think my slides, you can go on to the next slide. So if we can catch patients when they come up with during the time of the mini stroke, there is a good chance that we can initiate treatment and check for risk factors behind the stroke and mitigate the stroke that is about to happen. So data has shown that just by following simple algorithm, looking at their age, the presence of blood pressure, diabetes, and also looking for any cardiac rhythm disturbances, or looking for the carotid artery to look for any plaque, we can easily identify patients who are at higher risk. And we do a scale for that called ABCD2 scale, or CHATS 2 as scale. And the point I'm making here is please do not ignore signs and symptoms of a mini stroke. Please come to the nearest hospital or go and see a general practitioner or a neurologist and check it out to make sure you're not having a mini stroke. And coming to the risk factors, as Dr. Hari said, the commonest age nowadays, people having stroke, is the most productive age group. And unfortunately, as we are getting more urbanized in India, we are getting more sedentary. We are not looking after our risk factors, like blood pressure, diabetes, and more people are taking up into smoking and even heavy alcohol use, and also even drugs nowadays. Because of sedentary lifestyle, the overall BMI across India is increasing every year. The risk of diabetes is manifold in India. It's become a huge public health burden. And within risk factors, in terms of stroke, we classify them as modifiable and non-modifiable. If you look at modifiable, obviously, whatever I just mentioned are easily modifiable. Same are like high cholesterol. Those who have heart disease can be easily picked up. As people age, the risk of heart ailments increase, and the risk of atrial fibrillation with any pre-existing coronary artery disease is higher. Alcohol abuse can also affect the heart indirectly. So these are all easily modifiable, and with the right advice and the right follow-up, these can be easily prevented. There are a few non-modifiable risk factors, like as we age, our arteries get hardened, and which can predispose one to a higher risk of stroke. And stroke used to be a disease of old age in the 80s and 90s because of hardening of arteries. But nowadays it has become a disease in the 30s and 40s. And it's very unfortunate. We see a lot of youngsters coming up with stroke. If you look at race, ethnicity, there are certain races like Hispanic race, South Asians, who have a smaller caliber of arteries, which predispose us to early strokes. And also we have a higher risk of developing diabetes and obesity. And if you have a family history of stroke, that might relate to certain gene risk factors, which are very rare. And some of us may carry a higher clotable protein in our body. There are many of them that we look for if somebody comes with a stroke in their young age. The commonest one I would like to mention here is homocysteine, which is easily identifiable, and often a common reason in some of the younger strokes that we see nowadays. A high homocysteine level causes premature hardening of arteries and plaque deposition on the arteries, and also make the blood easily clotable. And the risk factor for homocysteine, high homocysteine, are very easy to identify. Those who have low B12 folic acid levels and B6 thiamine levels are more prone to develop high homocysteine. And unfortunately, patients who are extremely purely vegan are prone to develop B12 deficiency, and they should think about having the B12 and folic acid checks at least once in 2 years to prevent stroke due to hyperhomocysteinemia. So now I'll move on to treatment. And so the key in treating a stroke successfully is time, and also being at the right place at the right time. There are a lot of times we see patients who have gone and met their family doctor, who may have asked them to go and have a MRI or a CT done. And then by the time they come back to see the doctor with a report, the stroke is established, and the golden hour is wasted. So if you actually look at how stroke is treated in North America or Europe, if somebody has a stroke, they have to be treated in a comprehensive stroke center. And unfortunately, we don't have that concept embedded in our healthcare system in India. But what we have set up in Kauvery is a comprehensive stroke care center across all Kauvery centers. And quite a lot of hospitals in urban areas have come up with comprehensive stroke care centers. And it is manned by a neurologist, neurosurgeon, a neurointerventionalist, which also has facilities for neurointensive monitoring of patient with a neuro ICU trained staff, with all the other infrastructure that goes with it, like a fully trained ER staff who are prompt in identifying stroke and getting CT or MRI promptly. And if necessary, if the artery that is blocked is a larger one, we have to consider a mechanical clot removal beyond chemical clot lysis with a thrombolytic agent. And obviously, within the next day or two after stroke, we would make them sit out and make them stand and start the process of rehabilitation. A comprehensive stroke care center encompasses all of these, where there are trained staff with proper infrastructure, where there is a regular training program with quality control audits that are being done to make sure the processes are kept up to speed and place. So, as I said, the chemical clot lysis are commonly mentioned in layman terms a clot buster, which is a medicine that we can use in the first 4.5 hours only. So it doesn't mean you can come to hospital right at the fag end of the 4.5 hours. The data shows that if your clot buster is given in the first hour after your stroke, the outcomes are much better than the second or third hour or fourth hour. So whenever we say 4.5 hours is safe, it doesn't mean you can wait until 4.5 hours. You have to be within 4.5 hours for us to use the drug. That is what it means. And what the clot does, the drug does is it unblocks the mesh of fibrin and platelets that are sticking together, blocking the blood vessel, and it may recanalize the artery. And if the artery that is blocked is a larger one, for example, in the carotid or in the early part of the brain vessel called middle cerebral artery, the technique that we use is called thrombectomy, for which we would do an angiogram right at the beginning. And in a comprehensive stroke center, for the public to be aware, a CT scan or MRI scan has to be done within the 40 minutes of arrival into the hospital. So we have a very strict door to scan time and also door to needle time. The earlier your door to scan time is, and we are proud to say we do our scans within 20 minutes of arrival, and we start the treatment within 40 minutes of arrival. So that is how fast the treatment has to be. So if we, in the cath lab, what as the cartoon shows, we would pass a catheter where the clot is caught within the stent, and then we would pull the clot out. And quite often, patients start moving their arms and legs and start talking on the cath lab table itself. And stroke, until in the early 1990s, was a disease that was not of much interest to doctors because there were not much treatment available. But nowadays, we have plenty of options in hand, and even the catheter techniques are evolving as we speak. Rather than having a long puncture from the groin upwards towards the chest and into the neck, there are catheters that are coming where you can puncture directly in the neck and have the procedure done in a very quick and faster recovery is guaranteed by that way. And to emphasize the time, the mechanical clot retrieval can only be done up to 6 hours from the onset of stroke. And in certain individuals who come with stroke in the backside of the head, where we call it as a basilar artery, we can carry on. We can go ahead and do the procedure even up to 12 to 24 hours in selected patients if we can ascertain that the stroke is still, the brain tissue is still viable, for which we have specialized scans called multimodal imaging. And as you can see, a tiny clot can end a person's life. A tiny clot of few millimeter in the basilar artery can be fatal, and basilar artery strokes carry 100% mortality. So that is why we extend the time window in patients who come with basilar artery strokes. Not all strokes are treated this manner. Some strokes are due to bleed in the brain, maybe due to various reasons. And I would pass on to Dr. Hari, who is going to explain on the surgical management in stroke.
Okay. Thank you, sir, for the wonderful presentation. So, surgical management in stroke, that is a neurosurgeon's role in stroke, comes very rarely actually. And again, time plays a major role. If the patient comes to the comprehensive stroke center early, the need for neurosurgeon comes down drastically. Once once the damage is established, there is very limited options. There are very limited options to do to recover the function. So my role or any neurosurgeon's role in management of stroke comes to save the life. So it is not a function preserving surgery or function recovering surgery. It is a surgery to save life. So that is that point of that is where the awareness plays a big role. If the patients come early, a surgeon's role can be avoided, and disability can also be avoided. So surgery, there are of two types of surgery. There are preventive surgeries for stroke, and there are damage control surgeries. So preventive surgery, there are, as sir told, there are events called transient ischemic attacks. That means that is called a mini stroke or a warning stroke. So whenever a warning stroke comes, whenever something off is felt, like some numbness in the hand, speech difficulty, arm weakness, some balance difficulty, all these things comes, it should not be ignored. And as sir told, early medical consultation is very, very important. So another thing is, So this is the blood vessel which comes from the heart to the brain. So this type of this blood vessel is present in both sides of the neck, one in the right side and one in the left side. So 70% of 15% of all ischemic strokes, that is strokes occurring due to a block in the blood vessel, are due to a pre-existing block in the this vessel. This blood vessel is called the carotid artery. So any block progressing to occlude the entire lumen of this blood vessel can cause a stroke in the brain, can cause a ischemic stroke in the brain and can cause damage. So all these, any mini stroke or warning stroke should be evaluated for a stenosis of the carotid artery, that vessel which is supplying the brain from heart through both sides of the neck. So a simple Doppler scan can tell the amount of blockage and how risky for him for his a new stroke. We can assess that also with a simple Doppler scan. So any stenosis, any blockage which is more than 70% should be ideally addressed within first 2 weeks of the symptom onset. That means if we do not treat any significant amount of stenosis, there is a higher chance of stroke in that patient. Stenosis less than 70% can be managed with medicines alone. So this is a pictorial representation. This is the vessel seen in 3D reconstruction. So as you can see, this is the main vessel going to the brain. We can see a small stenosed segment in this part. So obviously the amount of blood coming through this part is not going to be going through this with a stenosis like that. So what we have got, this is a preventive surgery. This artery is opened surgically and it is evacuated under microscope. This is one option for removing the plaque and subsequently reducing the risk of stroke. The another option is, as sir told, we can give a small puncture in one of the vessels and go inside that vessel and remove the clot and expand the vessel. We can see this is the stent in place. Slowly the stent is expanding and we can see the flow reverted to normal levels and thereby reducing the risk of stroke. So both these are preventive surgeries for warning strokes or strokes which have established cause arriving from the carotid artery. So then comes ischemic stroke. We have seen a lot of things. Then comes hemorrhagic stroke. This type of stroke occurs when the blood vessel in the brain bursts open and the blood which has to stay inside the blood vessel comes out and goes into the brain parenchyma. This, what we can see in the left, is the white color thing is the blood leaked in the brain. So this all these bleedings can be removed surgically and thereby improve outcome. We cannot cannot always recover function in hemorrhagic stroke, but with physiotherapy and time, some amount of recovery in function is possible. So this is another case where bleeding was there due to uncontrolled BP, which was removed through a small hole in the brain. Nowadays, we see a lot of bleeding hemorrhagic strokes because of very common usage of ecosprin, aspirin, clopidogrel, warfarin, and other blood thinning agents. All these drugs are given for various conditions to reduce the thickness of viscosity of blood so that the blood flow is normal across all places. So the increased use of these drugs are also predisposing to hemorrhagic stroke in these patients. So then another major cause of hemorrhagic stroke is an aneurysmal rupture. So this starts presenting as a sudden onset of worst headache of life, the patient's life. There will be severe pain in the headache, severe pain in the head, and severe pain in the neck on movements also. Such patients should come to the comprehensive neuro care or comprehensive stroke center immediately, because that could be a reason for immediate mortality also. So this is a typical aneurysmal rupture scan, which shows a star-shaped bleed. So this is easier to understand. This is the normal blood supplying, normal blood
Yeah.
vessels in the brain. So you can see in the left encircled part, there is a small.
I'm in a webinar.
There is a small bulge in the blood vessel, which is burst and the blood is leaked outside. The problem with this type of rupture is it keeps happening again and again, and if not eliminated from the circulation, this can pose as a significant risk and cause death. So this is various images of the same aneurysm, that is the bulge in the blood vessel is seen here, it is seen here, it is seen here, it is seen here. So once the blood vessel ruptures, what we can do is go inside, identify the blood vessel and clip the blood vessel like this, so that it is eliminated from the circulation and no other blood is lost through this bulge. So this is how the clip is placed in that bulge. So there are specialized microscopes, specialized instruments to identify this intraoperatively and clip it properly. So once this happens, again the risk comes down. This is actually in Japan, the prevalence of this aneurysm or the blood vessel bulge is so high that people screen for aneurysm, and it is done as a preventive surgery in Japan. So then another condition where a neurosurgeon's role is there is, especially after this COVID era, is venous thrombosis. Veins, as you know, are blood vessels which carry the used blood again to the heart for purification and the recirculation. When there can be blocks in those veins also, in drainage pipes also. These are called the drainage pipes. So these pipes also can have blocks, which can also cause significant morbidity and mortality and significant disability. So any post-COVID patient, it has come down now already, but the risk was really high. The prevalence was also, we saw a lot of patients during post-COVID times. So this is another drainage pipe block where this is the normal vessel that is not at all seen. So once there is some obstruction to the normal flow of the brain, the blood comes out into the brain parenchyma and again causes problems. So again, prevention will be talked by Dr. Sivarajan sir.
You have to unmute yourself, Dr. Shivarajan. Unmute.
Yeah.
Yeah, thank you so much. And as you showed in a very good, easily understandable way on how we manage hemorrhagic strokes. The aneurysms are the most devastating kind of strokes, and it's quite often the scariest type of stroke, because patients who present with aneurysmal bleed, nearly a quarter of them may not survive reaching a hospital, and another quarter of patients who are in the hospital often don't make up, often cannot survive within a week of being in hospital, because such a devastating kind of stroke. And prompt identification and early neurosurgical intervention can help in saving lives in this particular type of strokes. So how do we prevent strokes? வள்ளுவர் சொல்லியிருக்க வருமுன் காப்போம், எல்லா நோய் வர்றதுக்கு முன்னாடியே காத்துறது நல்லது. So active lifestyle with regular exercises, keep moving, and if anybody has history of diabetes or hypertension, make sure you check it at home. Quite often patients come to our OP with a blood report that was taken 3 months ago, 6 months ago, even a year ago, and they carry on taking the same sort of blood pressure and sugar medicines. And when we check, the numbers are extremely high. Sugar can only be controlled if patients monitor by themselves at home. And then only you can identify that it is uncontrolled early on and get advice to change your medicines. Nearly half of patients who have hypertension are unaware they have hypertension. And even if they are aware of it, half of them do not know their targets, what should be their right blood pressure. And even in educated individuals who know that that is the target, people are often careless and they don't actually check it periodically and carry on taking the same medicines, or even they're not compliant with medicines. So please, the commonest risk factors for stroke is hypertension, followed by diabetes, and smoking and alcohol. If these four can be controlled, almost 50% of strokes can be prevented. A healthy diet with high fiber and low fat obviously goes a long way. And nowadays we see a lot of youngsters, especially working in IT industry, coming up with strokes, diabetes, and a lot of women develop polycystic ovarian syndrome, infertility, insulin resistance, and quite often the science that is behind that is prolonged sitting. We know that sitting is the new smoking. I mean, for decades we were advocating against smoking, that smoking kills, but actually sitting kills more than smoking. So people should not sit in their chairs beyond 20 minutes to 30 minutes. And everybody who's in a prolonged sitting duty in their office should take a break away from sitting for at least 3 minutes, where they can go up and down a stair or go and talk to a colleague in the other end of the office. And I often tell my patients to not to go all the way up to their office when they are going in their car or a two-wheeler. I advise them to park maybe a kilometer away and walk to the office or place of work. So in a workplace, we can do regular stretches, do stairs, wall push-ups, squats, leg lifts. While you're sitting in a chair, we can just simply lift your knees, make your knees go straight, which will strengthen your thighs. And again, it'll again prevent early onset osteoarthritis of knees if people can do regular knee stretches while they're at work. There are quite a few pictures that depicts exactly how these can be done. These things can be easily downloaded from the net. And obviously this is recorded and people can have a look at these exercises later on. And control. So controlling sugars, controlling blood pressure. And I would like to mention that often when we see diabetic patients, when I say, what is your HbA1c, they actually have no clue. HbA1c is the most important blood test a diabetic person should do, which measures your average sugar in the last 3 months. Because random sugar checks in a lab may show spuriously low or high numbers, but HbA1c is the one that tells how good your sugar control was in the last 3 months. And it should be always less than 7 in a diabetic person. And in non-diabetic, it is less than 5.5. And we do see patients who have strokes, and that is the first time they know that they have diabetes, and often the HbA1c is like 11, 12, 13. They are like sitting time bombs to have a heart attack or a stroke. So please, if you're a diabetic, make sure you have your HbA1c checked at least 4 monthly every year, and regularly have a check with your doctor about your kidneys, your retina scan, and a master health check, especially in those who have risk factors like high sugar, high cholesterol, and if somebody has a history of high smoking and alcohol use. And sleep and limiting stress is equally important. A lot of our patients, especially youngsters who come with stroke, have been under a lot of stress, and stress increases a lot of your stress hormones in the body like cortisol, adrenaline, which predisposes to early onset of arterial disease. And it also makes your heart rhythm go abnormal during sleep, which can predispose to early onset coronary disease and also coronary arterial disease. And stress can lead on to substance abuse like heavy smoking and alcohol use, which predisposes to more complications. Sleep is very important. A lot of school teenagers, youngsters think that, yes, I'm sleeping at least 7 hours, but they go to bed at 1 a.m. and get up at 8 a.m. And that is not the right amount of sleep. We have to sleep at the right time, earlier, at least before 10, and wake up by 5:36 at least, because sleeping at right time is as good as going on a holiday where you relax yourself and come back. So sleep is very, very, very important. And diet, limit your carbohydrates, eat a good amount of proteins, limit fat. I would always say do not take any fried items, and increase the amount of vegetables like salads, fiber. And I ask my patient not to add salt on table. I mean, even in cooking, it is better to limit the salt. And nowadays, youngsters prefer all the fizzy drinks and colas and everything. All of them have extremely high sugar. And I learned the other day that in one bottle of a fizzy drink, there are at least 15 packets of sugar equivalent carbohydrate mixed in it. So we have to avoid and educate our youngsters not to use sugary drinks. Weight is something that we can easily check at home. A high BMI increases a lot of risk factors, including type 2 diabetes and also obstructive sleep apnea. So if somebody at home is a heavy snorer, and if they have long pauses in their breath during sleep, that is a very big risk factor for early onset diabetes, hypertension, coronary artery disease, and so on. So snorers, please have your BMI checked and make sure you talk to your doctor to see if you have obstructive sleep apnea, which is another silent health burden in India. And keeping up with your routine medical checkups is very important. And those who have already had a stroke, it is very vital that they come to our outpatient visits to make sure their risk factors are adequately controlled. And heart and brain, they go together. If there is an issue in the heart, it reflects in the brain. And if there is an issue in the brain, it can affect the heart. So we have to look after our heart and brain health by looking after our lifestyle and all the other modifiable risk factors. Thank you, Dr. Hari. I'll pass it on to you.
Yeah. Sir, you have summarized all the preventive measures and the subsequent treatment options available in the current scenario. So the carry-home message for today's presentation is going to be, we should all understand that 80% of strokes are preventable and treatable when you come at the right time. So we should all know the risk factors, familial risk factors, that is modifiable risk factors and non-modifiable risk factors are all, we should always be aware of it. And early signs of stroke, how to identify a stroke in your near and dear is very vital to start on-time treatment. So everybody should be aware of that. And first 4.5 hours is very, very, very critical. That is the magic number. Nowadays, even for up to 8 to 12 hours, treatment options are available. But again, where and all you get those treatment is still a question. In our setup, early visit to hospital whenever something is off normal is very important. So again, thank you. I can go with the questions.
Your voice. Can you?
Am I audible?
No.
No. Okay, I'm done. The presentation is over. That's the carry-home message.
Okay. Okay then. Okay. Thank you, doctors. That was a real intensive and a very exhaustive presentation, kind of including the entire spectrum of brain care, from identifying a stroke to treatment to prevention, and of course, the vital messages that we need to carry home. I'll just, because we've already almost run through half the program and questions have started coming in, I'll start taking them. Just before that, you did mention about this comprehensive stroke centers. I just wanted to ask you, what is the treatment protocol actually available for patients? Because normally we end up in a general hospital, right? So are these centers like anything very different and specialized? And should patients people identify something near their house? And if so, not the entire country is blessed with such facilities. So could you just give that bit of explanation?
So Actually the government has taken a few steps in this area, and the government centers in Tamil Nadu have started stroke thrombolysis, which is initiated through the Madras Medical College, and they have trained doctors in a lot of district health centers, district hospitals and peripheries, and they have actually started doing a lot of peripheral hospitals in the peripheries have started treating stroke on time. But most of the healthcare is delivered via public, not via public, but by private hospitals in India. And amongst the private hospitals, we have a huge spectrum, like hospitals that are multi-speciality with all these specialties in one roof, and there are single specialty hospitals. But when a stroke happens, the instinct in anybody's household is to go to the nearest medical center where they can have a first aid or they can have things checked. And often they may go to their family doctor who may open their clinic 4 hours away. So that sort of concept should change. If somebody has any focal neurological change, for example, a sudden visual blurring, speech arrest, loss of function in their arm or leg, or if they are unable to balance when they are walking, the first thing that should go through their mind is, could this be a stroke? And where are they going to be seen? Because yes, you may go to a place where you know the doctor and they may do the right thing. But if you lose out on the time where we can do the acute treatment, nothing can be done beyond that. So in a comprehensive stroke center, to answer your question, it encompasses a lot of things. For example, it should have at least a basic minimum CT scan facility, and to help patients with larger artery strokes, a cath lab facility. And sometimes we do have what we call as a drip and ship method, where we start the treatment like a chemical clot lysis, clot buster treatment in one place, and then transfer the patient to a center where there is a cath lab facility where we can remove the clot efficiently on time. So even in those small setups who don't have such facility, they should have tie up with a larger center which has got all the facilities to transfer patients on time. So that involves educating the hospitals apart from the public. And so in America, there is a law that states anybody who has got acute stroke should not be treated in their hospital if they're not a certified stroke center. So they should be transferred to the nearest certified stroke center. So the government should come up with a certification method where each and every stroke center comes up and with all the minimum requirement to treat a stroke patient. And those centers should be advertised to everybody to make sure they have all the facilities in hand. So.
Yeah, right. Because a lot of onus is on the patient. The person has to identify the symptoms. The person has to rush to the center within that golden hour. So, but that facility should also be available. That's why I asked this question. Okay, we'll quickly start with the questions. Mr. Alphonse is asking that will music listening and music instrument learning help in brain health, especially for a senior citizen? I'm 67 years old with reasonably good health, except for controlled diabetes. Please throw some light on this explanation with tips.
Dr. Hari, or shall I?
Yes, sir. Yeah. See, learning any new thing is good for the brain. So especially if it is in old age, from middle age itself, from around 35, 40 years itself, something new should be learned whenever we get opportunity. Learning a new musical instrument or learning a new sport, all these things help in keeping the brain active. And one more thing, these new games, learning new things are one way this helps it opens new social circles. That is also good for brain health. So it is definitely good for brain health. And what is the second part of the question?
Second part is, I am 67 with reasonably good health except for controlled diabetes.
Okay. So there is no question.
Yeah, no, he was just giving his. Okay, Mr. Krishna is saying a person has third stage migraine problem due to which She feels continuous headache and frequent blackouts.
Okay.
Seek your valuable information.
Sir?
Okay, migraine. Migraine can be a very debilitating issue but in a very small minority of patients. But migraine, again, like stroke, is triggered by lifestyle choices, like those who have poor sleep, those who
Third question,
tend
Villa.
adequately, those who have lifestyle choices where they indulge in a lot of fast food, they have increased risk of migraine. But migraine is actually a hereditary disease. There are a lot of genes that confer somebody to carry migraine, and it runs in the family. And 10% of migraineurs may go on to become chronic migraineurs, and a proportion of them may have extremely severe headaches. I hear that she mentioned she gets blackouts. I'm not sure what that means, but migraineurs having blackouts is very rare. But there is a subtype of migraine called hemiplegic migraine, where patients can experience stroke-like symptoms with migraine. Often, migraine is one of the stroke mimics. And with this question, I'll also mention that the commonest stroke mimic is low sugar. So that's why every time any patient comes to our ER with a stroke symptom, the first thing we do is check the sugar. In this particular individual, I would recommend them to have their heart also checked, because having blackouts is something unusual. Heart rhythm and echocardiogram will also be beneficial.
Right. Somebody is saying my father was affected by hemorrhage stroke in November 2022, and he has not undergone any surgery. Now he's doing his daily routine, but his right side is paralyzed. 50% recovery is still awaited. How long will it take?
Okay. So it is going to take at least 6 months to 1 year minimum. And the recovery is not a fixed thing. It cannot be like defined. Everybody will just get this much amount of recovery post stroke with rehabilitation or whatever sort of physiotherapy we give. It is always subjective. So we cannot basically predict to a very good extent that he will be improving in this much year. All these things we cannot do. And he is improved, and he's able to do his daily routine. That is the main aim of the rehabilitation program. If he is able to do his daily routine without any others' help, that is, I think, where we should be happy about, at least for the time being, and expect much recovery later. And we should be controlling all these things, should be ongoing, like diet, modification in lifestyle. Everything should be ongoing, and physiotherapy should also be ongoing. So it will take a long time, but we cannot basically predict how long it will take.
What should a person do who has been accidentally detected of common carotid plaque but has no symptoms or comorbidities?
So as Doctor mentioned during his talk, if the plaque, the stenosis is less than 70%, it's best managed medically. If it is more than 70, even if it is asymptomatic, not causing symptoms, nowadays we advocate fixing it because the risk of them having stroke is high. In those individuals between 50 to 70, again, if they have symptoms, we would still go ahead and do a few other investigations to see if a plaque rupture, if there is any ulceration of the plaque, and see if that also needs to be fixed. So it is individual. It is a personalized care which takes into information on all aspects, like their lifestyle, other risk factors, what is the likelihood of this getting vulnerable, and so on.
So Mr. Ram Shankar Jha says, if you have already had a hemorrhagic stroke, what chances are there that it can occur again, and what should you do to prevent it?
Yeah. So hemorrhagic strokes, again, we discussed previously, there are many types in it. Generally, if the hemorrhage or the bleeding occurs due to a high blood pressure control is the treatment. So if it is due to some other surgically treatable cause, then surgery is the treatment. If again, once after suffering a hemorrhagic stroke, if the patient does not follow any of the medications or the lifestyle modifications as advised by the doctor to him, he is more likely to have a ischemic stroke also and hemorrhagic stroke also. Both chances are going up.
How to improve neuroplasticity post-stroke? Reddy is asking, his father, who's 62 years old, lost his field vision in the right side and is confused.
Okay, so neuroplasticity is what we aim to achieve with rehabilitation. So that involves doing things in a very structured way. For example, if somebody has a complete weakness on one side, the physiotherapist, occupational therapist would initiate certain sequence of therapy streams where they would do initial passive movements and then they will stimulate the muscles. They'll use splints to avoid shortening of muscle and prevent contractures. Sometimes we use electrical stimulation to keep the muscles active. As we do more and more repetitions, the word repetition is commonly used in physiotherapy. The same activity is repeated with assistance, without assistance, and so on. Sometimes we use additional aids like robotics, biofeedback, using a computer game like simulatory techniques to enhance the brain's ability to overcome the inhibition. So neuroplasticity is simply the wiring in the brain is rerouted. For example, if the wiring between one area, the motor area, is blocked that controls the arm, the information is carried via different pathways. So by relearning in a high number of repetition, you may create pathways to increase your chances of getting into functional activities. So the number one is repetition. Number two is use of certain techniques like biofeedback. Number three is certain medicines. There are a lot of neurotropic drugs that can be used to improve the neuronal function. Again, if somebody has been before the stroke, if they had a very high functional level, for example, they're very active, walking every day, if they have a good educational base where they have a wide variety of social interests like music, books, and so on, we notice that they recover faster. So they have higher number of brain wires that can help them to recover. So even after stroke, listening to music, trying to learn new things at home, even simple Sudoku, word games, even playing a carom board, card games, all of them can help with neuroplasticity apart from physical rehabilitation.
Right. Actually, a lot of people are worried about whether there's a possibility of recurrence. Like somebody's again writing, my sister who's 23 years old had an acute ischemic stroke few months ago. Her symptoms were double vision, losing balance while walking. Now she's taking blood thinner regularly. Is there any chance that she might get a stroke again? 23, as you were mentioning, it's how the age is getting younger.
So the risk of stroke in early age is often genetic in nature. As she mentioned, she's already on a blood thinner. Maybe she probably had a easy clotting tendency. Sometimes it can be because of traditional risk factors that we see in old age also. The risk of stroke in anybody who had a stroke is always about 10% year on year. And with right control of risk factors, we can bring it right down to 2%. But we can never make it zero because there are certain things that are already there in the system that we cannot modify. Like if somebody had a hemorrhagic stroke with hypertension, if we can control their blood pressure promptly and consistently, they can never have a second stroke. But there are certain old age conditions called cerebral amyloid angiopathy, where the brain accumulates a lot of amyloid protein. In those individuals, the risk is always maintained, but we can still reduce the risk by not allowing them to have high blood pressure, high sugar, and so on. So some modified risk factors and non-modified risk factors come into play in terms of recurrence rate. In this young girl, I think if she can maintain her risk under control, she can avoid a second stroke. They should not be afraid that she's going to have another one.
Tariq Shah's wife suffered SAH
Yeah.
after delivering a baby through
Yeah.
cesarean, and she was managed conservatively in the hospital and recovered fully. But he wants to know what further steps should she take to avoid recurrence, and does she need further treatment?
Yeah, okay. So SAH is again a sort of bleeding inside the brain. It's called subarachnoid hemorrhage. So subarachnoid hemorrhage usually happens when aneurysm ruptures. That is the bulge in the brain, the blood vessel in the brain, blood ruptures, bursts, and the blood comes out in the subarachnoid space, and that is called the subarachnoid hemorrhage. So there are conditions where a subarachnoid hemorrhage can happen without any bulge in the blood vessel. So we should first make sure that whether something is there which has to be addressed, or it is just a spontaneous. There is something called perimesencephalic bleed. It does not have a bulged blood vessel. So to find out, we should get a CT angiogram or a digital subtraction angiography (TSA) to know the anatomy of the vasculature inside the brain and plan accordingly. That should be done. That should be done.
Eminarin wants to know, can emotional stress or psychological depression cause stroke, even if you're on a healthy diet and follow a healthy lifestyle?
Yeah, stress is becoming a huge health burden for both heart attacks and stroke. And yes, it can. When you are depressed, even despite maintaining a good, healthy lifestyle, we may fall back into certain food habits, certain medicines that we use in a long term for maintaining depression can make you gain weight, which can predispose to other effects. And seeing the psychiatrist regularly and keeping the mood stabilized is very important. Yes, it can predispose to lifestyle conditions like stroke and heart attacks. But if treated correctly, it shouldn't be a big problem.
And if somebody is on a blood thinner, they have to be a lifetime on blood thinners?
It depends. If it is due to, for example, atrial fibrillation with irregular heart rhythm or a weakened heart, we use stronger blood thinners like anticoagulants, and it is lifelong. Post-stroke, if they have arterial disease like atherosclerosis, like plaque deposition, or if they have additional risk factors like vascular risk factors, then again, it is most likely lifelong. Initially, we use 2 drugs, and then we scale it down to one single agent like aspirin or clopidogrel. Certain individuals may get a stroke because of what we call as dissection due to some tear in the blood vessel. In those individuals, we use it for a shorter period, 6 to 12 months. Some strokes can happen because of infections like tuberculosis or sometimes COVID-related high clotting tendencies. In those individuals, it is temporary, like 6 to 12 months, and we stop it. So it is not always lifelong. It depends upon why they had the stroke.
Right. So, and you also talked about a mini stroke, a temporary stroke, or a major stroke. So people want to know how to differentiate between these 3 types of strokes, because often, say for instance, blackout, it could also be because of ear problems, and it may not be a stroke. So what is that thin line which differentiates, these 3 strokes, and people at home could kind of make it out?
So anything that is out of character, we should always worry. So if somebody had a simple faint and if they recover completely, that is, we can't be alarmed about each and every symptom we have. So if you notice anything that is focal and unilateral, so stroke, when it strikes, usually it obeys the midline quite often. So if one half of your body is affected rather than both sides, then it is most likely a stroke, like arm and leg weaker on one side. Speech, if it is affected for no other reason. Balance, you can't always say it is one-sided, it can be both-sided. The FAST can differentiate to some extent. And if in doubt, don't waste time, get it checked. So it's better to be safe than sorry.
Mhm. And if somebody has had a minor hemorrhage, Bhavya says she's a 27-year-old choreographer. Due to an accident, she suffered a minor hemorrhage. Can she go back to dancing?
Yeah,
Yes, sir.
please go on.
Yes, choreographer, minor due to accident. See, accidents, head injuries per se, we should know the prior status one and status after the injury and what sort of treatment was given for the minor hemorrhage that she is mentioning. Because it depends on the location of the injury and each location in the brain caters to a different need. So if and how long was the one before 1 month? So we don't have much information about what is the nature of the injury, but with if it is a minor hemorrhage, you can definitely do that.
Nagaraj Sutar is bombarding with questions on taking bath with cold water or hot water. Does cold water bath have any problems for the brain?
No, it doesn't. But there is a lot of myth around it. Like, Russians do ice water bath, and once in a year and a lot of health sort of promotion is there behind having yourself immersed in a ice tub, and which increases your peripheral nerve strength and so on. There may be some signs, but they cannot be generalized. There are patients who may have severe peripheral neuropathy, and they may have a severe frostbite in their toes, and it is personal choice. It doesn't make a huge difference in the way one gets a stroke. If you're happy to have a cold shower, it's fine. If you're happy to have a warm shower, it's okay. I don't think it matters much.
Shina, who's 45 years old, says that her BP is always low, and she's also observing that she gets low blood sugar immediately after having food. But what care she needs to take since brain calcification has started?
Okay, she's 45 and she
low BP and low blood sugar.
Okay, so having a tendency to have low blood pressure after food is physiological because the blood is diverted towards your tummy for absorption of nutrients. But if it is profound, beyond more than say 20 millimeter mercury in the systole or more than 10 in diastole, it is significant, which may indicate somebody has a little autonomic dysfunction, autonomic nerve hyperactivity or underactivity. The other thing is she's mentioned she has low sugar after eating. Is that right? So
yes.
that may be again a precursor for someone at risk of insulin resistance. Often we do patients coming to OP where they say that my fasting sugar is 200. After eating, my sugar is going down to 90. So that is again a risk factor for them having insulin resistance. Making sure they check the insulin resistance and the HbA1c level, insulin level, and talking to endocrinologist will help.
Mr. Ramesh B is, I think, really stressed out, and he specifically mentioned that I suffered a stroke after marriage at 32. I couldn't handle fights at home, and I was healthy till then. I used to do 25 kilometers of walk on the treadmill. He says then he gave up smoking. He quit smoking, and again he suffered a stroke. So he just wants to know, because he's not able to run anymore. So he's asking for some tips and advice.
Okay. I think we need to know his all the other risk factors. With right physical training, we can help him to maximize his physical ability. It depends if he had a very large stroke, leaving him heavily disabled. We do what we call as goal setting with every patient. There are realistic goals and there are unrealistic goals. Depending upon the level of disability, we can say this is how much you may achieve with intense therapy and in the long term. And quite often, a lot of patients end up spending for physiotherapy for years together and they stay at the same level. So we need to give them correct data to say that this is how much we can achieve. You mentioned he's having difficulty coping with fights at home.
Yeah, he
That
does.
is something else we can manage at home. That is
Yeah.
a modifiable risk factor.
We can offer family counseling with our psychologist, and often that solve a lot of issues at home. Okay.
Right. Okay, I'll just wind up because we've overshot our time. There's one last question on brain exercise. Is there anything that we can do to, the person says, refresh our brains?
Yeah, engage your brain. Brain engagement is like learning new stuff, learning a sport, learning a new musical instrument, learning a new language. We generally see people who know some 2 to 3 languages, they do better after a stroke or after a head injury. So learning always, trying to do new things, giving new experiences and new connections in the brain actually helps brain in a lot of way and prevents a lot of degenerative diseases. As long as it is used, it is healthy.
Okay, then it's time to draw the curtain. And thank you so much, Dr. Shivarajan and Dr. Srihari, for giving so many valuable inputs in a very, very understandable and fathomable manner. And I'm sure our listeners have got enough takeaway points. So I once again thank the panelists and all those who joined this webinar on taking care of the brain, brought to you by Kauvery Hospitals under the Hindu Wellness series. Thank you.
Thank you so much.
Thank you. Thank you.